Hey friends, thanks for tuning in. Really glad you could join us. So I'm really excited to have my special guest here with me today. We're coming at you today from just outside of Denver. We're in Littleton, Colorado. And I'm at ProjectMOVE, where I've been here a few times this year. This is an amazing place. So my guest today is the owner of ProjectMOVE. He's also the medical director at RockTape. And I'm really pleased to introduce my friend and my guest, Steve Capobianco, also known as Steve Capo.
Thank you, sir.
Thank you very much. How you doing, man?
I'm doing good. First, I want to give you kudos on saying my name correctly. That was well done. And second, we've had this opportunity to sit and rap off the air, if you will,
right.
for quite a few times. So this is the first time we've actually now logged it. So
yeah, and we've had the intention of doing this for a while now. So today's the day. So we've actually met earlier this year. We have many friends in common, Dr. Perry, and a number of people. And when I came here the first time we met, and every time I'm here, I'm always so inspired by what you're doing to reach out and help people to move better. I know, especially when it comes to taping, this is something I've experienced good results with my clientele. And I'd love to talk with you about your approach to taping and what you're finding out there, because it's pretty amazing, especially and I'm real nerdy when it comes to brain stuff. When we get into this whole sensory input, external cueing, the brain stuff, I know you have a lot to share about that.
I probably have more than you want to hear right now. But
I'm cool.
Yeah, when it comes to tape, it's just been a fortunate experience that I was presented with. 2009, I think, is when I first got introduced to RockTape. That gave me the platform to be able to share some of the science that we're learning in the last 5 to 6 years. But I've been using tape as a clinician for 12 to 13 years. Mm-hmm. And just recently I've been applying what we're learning in respect to what we're learning about the brain into how we're using this tape and how we're affecting not only movement of an athlete, but movement as someone that's compromised, like someone with neurological diseases such as cerebral palsy, muscular dystrophy, the multiple sclerosis, and then the Parkinson's community that we've been discussing in the last few months. That I think there's more to tape than just tape on the skin, and this is where RockTape has given me the platform to be able to express what we know about the brain, what we know about the skin in relationship to the brain, and how we can facilitate the conversation between the outer world and the brain, and how that makes a change into our motor behavior.
Yeah, it's really interesting. So tell me a little bit more about, when you're applying tape, let's say, what are you, we know it's a sensory input, right? I mean, as trainers, a lot of my the people who view this are personal trainers. So, of course, I don't have a license. I'm not a doctor. I'm not a massage therapist. I'm not a physical therapist. Yet, we can use tape as an external cueing.
Yeah.
I find this to be highly effective. But in your world, take us a little more in depth about what you're finding as far as sensory input and how the brain is responding, how the body is responding.
It's a good question. You brought up the term external cueing that I want to touch on, but just looking at tape, which I always have tape in arm's length from me wherever I go, but looking at this tape, and I guess probably first off we should explain what this tape is, because some may not even know what this tape is, but it's not what you and I grew up with, and maybe a lot of your viewers have grown up with, which is rigid athletic tape, cotton athletic tape. This tape is elastic. It's cotton and nylon, so if I peel the paper backing off of this and I pull the paper backing away from the fabric, this tape has the ability to stretch, and it stretches in what they call unidirectional stretch, which is directionally stretching in a vertical direction and not stretching in the horizontal direction. And all this means is that when we apply it to the skin, and I can use my leg for example, when I apply it onto the fabric of my shorts, and lay it down, it looks like it's just laying down on the fabric, but like any other elastic band, this tape will, over time, start to recoil back to the center, and you won't be able to see it really well from here, but what you'll see when you apply it onto fabric, it starts to coil the fabric and bunch it into the center, because that's where it's collecting all the elasticity. And what this is doing is it's stimulating, once it's applied to your skin, it's stimulating mechanoreceptors within the skin. And this conversation between the skin and the brain is now enhanced by stimulation of these mechanoreceptors via this elastic recoiling effect on the fabric of the skin, if you will.
Right.
And so just taking that into what we're learning, we can now take advantage of this elasticity and this stimulation of these mechanoreceptors to do several things. One, as a clinician, the number one reason people come to see a clinician is for pain mitigation.
Right.
So we can downgrade the painful experience several different ways. If we stimulate large mechanoreceptors in the skin, which travel faster to the brain than nociception or pain signals, we can actually reroute or dampen the painful experience from what we call presynaptic inhibition. So that's one cool thing that we could do is decrease painful experiences by just stimulating the area that's experiencing pain with a strip of tape or two. So that's the one thing that we could do through mechanoreception. The second thing as a clinician, that many of these painful experiences that we recognize, and once I say this, I think we're both going to sit up, but if someone has poor posture, it puts undue stress on these soft tissues and eventually will lead into a painful experience. So if we can put someone into a better position, give someone better ability to breathe adequately, we can potentially decrease the ongoing chances of having painful experiences. So now we're using tape to stimulate these same mechanoreceptors to give our brain information of where we are in space. And this kind of leads into, I think, what we were talking about, of this external cueing concept. External cueing, for those that don't know it, and I just became more aware of it in the past year, and it started off with someone called Nick Winkelman. Have you heard of that?
Oh yeah.
So Nick was originally with Exos, that used to be called Athletes Performance, I believe.
Right.
And he's done his PhD looking at better coaching cueing, how to cue someone to move better. And one of the things that he said at one of his speaking engagements was that external cueing is 100 times out of 100 times more effective than internal cueing. So what he meant by that was that if I tell someone to squeeze their shoulder blades together or retract their shoulder blades to improve someone's upper cross syndrome, versus me sticking my finger between someone's shoulder blades and saying squeeze my fingers, the external cue of my finger, it's much more effective than asking them to internalize it and to retract their shoulder blades internally. And so I took that as a great opportunity to be able to say, well, how can tape be utilized now as an external cue to say, now I want you to pull into the tape or push away from the tape as an external cue. And that has been revolutionary in my community here at ProjectMOVE, was where we're teaching people how to move more effectively, and now we're utilizing tape to be able to cue their movement by a strip of tape in different parts of the body to give them better awareness and acting as an external cue.
It's really powerful, because what I find, and when I apply tape as an external cue, and from personal experience, having a tendency to be a little bit like this, admittedly, I'm not proud of it, but it is that way. When I have the crisscross on the back especially, a lot of times I'll use the Big Daddy up here as well,
Yeah.
The strip across the top. So when I start to go into this posture, I get a reminder, right? The reminder is, wait, you're stretching, boom, get back up there. And what I'm noticing with clients is, especially, let's take Parkinson's for example, they're typical, this is generally speaking, but the typical posture would be kind of forward like this. And I just learned last week from Joe Ferrantelli, who now I have posture screen,
Yeah.
that your 9.4 pound head, for every inch you go forward, I'm not sure what the number of pounds are, it goes up, but it could weigh 40 pounds if you're out here. You're the equivalent of 40 pounds.
Yeah.
Right, so this can throw off our center of gravity, right, which for people with movement problems, that can be a real issue and maybe even cause falls.
Sure.
And we don't want that. So that reminder is awesome.
Yeah. Yeah, the postural taping, when it comes to the movement specialist, the non-clinician, is within the scope of practice. That's one that we should all recognize, is that if we're trying to change movement, and now we have a tool like tape that we can facilitate movement through this external cueing concept, I think it's a win-win. Now we need to be clear, and I think you and I spoke about this, is that you're not treating pain, you're not treating inflammation, you're not diagnosing anything. Is that what you're doing as a movement specialist is identifying movement deficit, and you're using a tool that's going to improve their awareness of where they are in space through this memory type of concept that you alluded to. And that is where, when we teach about taping to the movement specialist versus the clinician, we have a different conversation, just to be clear that we're not treating any painful scenario directly. We may be fortunate of identifying that a position is leading to a painful experience, but the goal is to improve their position and their movement as a movement specialist.
Exactly. Now, I'm going to ask a question. I didn't plan on asking this, but I'm going to. And in fact, it came up yesterday in a workshop I was teaching. So, you have the question that comes up about, what about if people start to rely on the tape and they can't function without it? I know what I'm finding on that. What are you finding on that?
It's a great question. I get it all the time, and there's two different camps, if you will. And so I get the opportunity of working with a general population, those that are just looking at improving their posture, decreasing pain because of their position or their movement, improving their ability to lift a specific weight. But their goals are consistent with, if I can improve their performance with a strip of tape, and we accomplish that goal, then they're not as reliant on the tape any longer, because now they've accomplished what they're looking for. Mm-hmm. Now, the other side of that equation are elite athletes and professional athletes. We all know that athletes are looking for the cutting edge in respect to performance, and once they find a tool that improves their performance, it's really hard to get tape off of those individuals, because they find it to be an enhancement into their performance, and they'll continue to wear it or use it until it no longer shows its benefit. Mm-hmm. Here's when it comes to the clinician and or the movement specialist, when I'm communicating this to them, is that this tape is a tool, and it's part of the tools that I have as a professional to improve their performance.
Sure.
If the tape is going to be used as a reminder of where they are in space, I need to attach that reminder with some type of load. So I want to challenge them with different stability and motor control exercises to improve their control, and eventually we start to wean them off the tape to have them recognize that they have the same control without tape as they did with tape, and that is usually good enough for them to start to move away from relying on the tape.
I'm finding the same thing, actually, even like with myself, where I don't need it as much. Although when I'm after a really long plane ride, as much as I try to have good posture, I'm like this.
Sure.
I'm curled up for 6 hours, and I'll use tape. But then I can get off of it quickly. But I love that it's there for me,
yeah.
And it's really great. I want to segue, because you have other tools besides tape.
Yeah.
Can you tell us a little bit about them?
Yeah, this company started off as a taping company, as most people recognize us as, but we've evolved into what we like to call as a movement company. And within this community that we serve, we get requests each year that we've been in existence, and they would say, well, I love the tape, but do you have a tool to improve mobility? I love the mobility, but do you have something that I could use as a clinician? So we've expanded our arsenal of tools that we have at RockTape coming from just having the tape itself. We have 2-inch tape, and then we also have the 4-inch tape, which we call Big Daddy, and I think you brought it up of
I love that stuff.
using the 4-inch tape as a greater reminder, since it covers obviously more part of the skin, stimulating more mechanoreception, more sensory input to the brain.
Definitely.
If indicated, this might be, you know, a great strip of tape to facilitate posture, for example. So the tape, we do have different stripes of tape. Then we also have different, what we call topicals, Rock Sauce and Rock Sauce Chill. Rock Sauce is our heating agent. It's a topical counter-irritant cream, if you will, that we could use in conjunction with tape that creates a chemical response, stimulates chemical receptors within the skin that actually helps to decrease pain.
Nice.
So these are 2 agents. The Rock Sauce is the heating, Rock Sauce Chill is the cooling agent. This has got menthol that creates a cooling effect, stimulating the same chemical receptors to help decrease pain.
Nice.
The one of the newest additions to our team are the RockTape blades. These are our instrument-assisted tools. These are part of the same community that are using different types of instruments, Graston, Hawk Grips. There's other companies out there that are using instruments. We joined into the network due to the request from our following, our RockTape docs and movement specialists, to be able to offer a set of 2 instruments to be able to accomplish the same task that a lot of them usually have, or 6 or 7 instruments to be able to accomplish it. But ultimately, using these instruments to improve mobility of structures, improving stability of structures by using them as a self-massage or as a clinical massage tool in practice.
Nice. Nice. I have to mention this because before we started rolling the camera, you were doing that thing with the blade.
Yeah.
Do you mind showing that?
Right. So the
just because we have people watching now that the Parkinson's program has gained quite a bit of traction, which thank you for that very much. We're always looking for new ideas to do cognitive training, and this one thing that you did is really cool.
Yeah. So when it comes to this instrument, quite often how it's taught is that we use as strictly as a massage tool, and so we are typically assessing the tissue to look for adhesions or scar tissue is what most people are told. And once we identify the areas that have adhesions, we use the instrument as a massage tool to quote unquote break up scar tissue. So as a mechanical tool, this has been very effective over the last decade to be able to improve mobility of tissue. But here's the spin that we're putting on the use of this instrument, is using what the science is telling us, is that we could use this instrument not only as a mechanical stimulus, but as a sensory stimulus to the brain. And so following what we know about sensory motor retraining, which is a tactic that's used in a lot of conditioning programs, where we can use the instrumentation as a sensory tool. So let's take an example as Carl's knee. Someone that has significant loss of awareness of where their knee is in space. We're going to use the tool not only to assess the soft tissue quality and looking for adhesions to improve mobility, but I also want to feed his brain to this part of the body by using the instruments. So I could just simply scrape over the knee and him just becoming aware of the knee through the added mechanoreception that I'm stimulating through the rubbing of that region. But what about if we add him as a cognitive partner into this treatment? So now I'm going to ask Carl to close his eyes, and I'm going to do the same treatment, but now I'm going to ask him to tell me what part of the knee am I treating, on the inside, outside, bottom, or top?
So your top medial.
Yeah, so the top inside portion of the knee. I want him to now tell me what letter am I drawing on him. I'm going to try to do it in a position that I can do it effectively.
Feels like it might be an M.
So I'm going to be saying
I'm not sure.
I'm in between a T and an M, so like just the difficulty of going through this area, but now I'm going to be doing it more deliberately, and so the top portion of the T and the bottom portion of the T, and I'm asking him to kind of be a partner into the treatment to now direct his attention to this area of the body that I'm quote unquote treating as a mechanical tool. I can say, am I going deep or heavy in his interpretation?
This is deeper than it was.
Right, so then he can say, now I'm doing deeper versus a feathering technique, which could be very light. So now I'm adding him as a cognitive partner into the treatment of his knee that I've recognized as being lacking in awareness, lacking in understanding of where it is in space, which is really important when it comes to chronic conditions like chronic knee or chronic back conditions.
Sure. Well, I think that's really great. You know, when we were talking about this earlier too. When I teach my workshops and we do the interactive portions, we have people from so many different backgrounds that come in and they share, you know, and I'll throw out a concept, say here's what we're trying to accomplish, and then they will take their experience and a lot of times come up with something I've never heard of that fits the concept and accomplishes the goal. Here's another one too. I love this. It's really good.
Yeah, I think we had this conversation, and maybe to kind of close the loop here, but what we do with RockTape and what we try to deliver as part of our ProjectMOVE system is that we teach more of concepts than we do techniques. So if I can teach you a concept, I in effect taught you 1,000 techniques, because now you can start to pick and choose when appropriate with the individual or a group that you're working with to be able to apply a specific concept versus being somewhat constrained by a technique.
Right.
And so like how we teach taping in conjunction to topicals, how we teach these mobility or traditional mobility tools like blading and self-myofascial release, that we don't want to teach the technique, but if we could teach you the concepts of what the techniques are based around, you can apply that to a lot of different models that you address.
Yeah, I love that. And that, you know, what you're doing here at ProjectMOVE, I just want to talk about ProjectMOVE. It's really important because this place is amazing. You know,
thank you.
All the people who are here, what you're doing as the driving force behind it as far as the concepts, right? We have concepts. You have an amazing staff here too of various types of professionals. Is there anything about ProjectMOVE in particular you'd like to share? Because
I'm proud of ProjectMOVE, so thank you for
it's an amazing, seriously, it's an amazing place.
And I have a team of owners, first and foremost, that help me develop the systems that we put into place. And I'm just fortunate to be one of them. But what we're trying to put into effect here is a multidisciplinary approach, and I know that's used quite commonly in the fitness community, but I think this is what we're really trying to do, is improve the communication between different disciplines, from a yoga discipline to a strength and conditioning discipline to a clinician. How do we communicate with each other? How do we create what I like to call vertical integration? Because if we don't have good communication, we don't have good systems in place, we really can't implement what we want to implement, which is in effect, regardless if I'm a clinician or a strength and conditioning practitioner, a strength and conditioning specialist to a yogi, we're all trying to improve movement. So the main goal here, and hence the name ProjectMOVE, is to improve movement. And if someone is in having a painful experience, how do we mitigate pain with the tools and the education that we have to get them to the next phase of their recovery, which is improving their movement quality? And how do we use tools like tape and other conditioning techniques to be able to improve their movement quality? And then how do we put performance on top of that if that's what they're looking for? And this is what we did at ProjectMOVE, is to put together a team that allows someone to go from a painful experience to a competent mover to a competent athlete. And that's really what we're trying to put together here.
It's great. I know whenever I come here, I feel energized when I walk in. Our conversations, I'm always energized and inspired, highly inspired. I walk out of here with my head spinning every time. It's really great. I love that stuff, But I think you're doing great things. And I travel a lot, and I do see a lot of nice places, great people. You guys have the edge.
Thanks.
It's really sweet. So well, this is cool, man. Thank you.
My pleasure.
Thank you so much for taking this time and joining me. I'm glad we got to do this today.
Yeah, me too.
So if you're in this area here, Denver, Littleton, you got to check out ProjectMOVE. And if you're not in the area, check it out anyways,
Yeah.
right? You
Check
have a
us
lot of
out.
workshops here too.
We do workshops here usually once a month. We're doing one December 10th that I want to reinforce.
Thank you.
The Parkinson regeneration training conducted by Carl himself. Check it out, December 10th at ProjectMOVE. We'll have it on our website and our social media so to get more information.
Yeah, a lot of great workshops here, so it's like it's just a great place. So thank you again.
Pleasure.
And thank you for tuning in and watching. Have a great day.